Women's Health West would like to acknowledge the traditional custodians of the land on which we are all meeting today. This land always was and always will be Aboriginal land. We pay our respects to elders past, present and emerging, and to all community members listening today. So hi and welcome everyone. My name is Sarah and I use the pronouns she and her, and I work as a sexual and reproductive health coordinator at Women's Health West.
And hi everyone, my name is Susan. I also use the pronouns she and her, and I work with Sarah at Women's Health West, where I'm the team leader for sexual and reproductive health.
Thanks, Susan. So the two of us are here today. It's the third in our series of 4 recordings as part of Melton's Lifelong Learning Festival. And this series of recordings has been informed by Melton parents with questions that they have about their child's sexual development. Today's recording is going to explore how to best support your child as their body changes and as they experience the emotional and physical changes that come with puberty. Joining us is Sal, who is a health promotion coordinator at Women's Health West, and she's going to join our conversation on children, young people and their development. So welcome, Sal. Thank you for joining us today. I was hoping you might be able to start just telling us a bit about your work at Women's Health West and also why you think this is an important topic to talk about.
Hi Sarah and Susan, thank you so much for inviting me to speak about this very important topic. So I work at Women's Health West as a health promotion coordinator as part of the FARRIP program. So FARRIP stands for the Family and Reproductive Rights Education Program, which has 2 parts. So one component of the program involves delivering sexual health and wellbeing programs to women and girls who are known to practice FGC, which stands for female genital cutting. And the other component involves delivering professional development sessions to doctors and healthcare practitioners. Puberty is a transition we all have experienced, and I believe we can acknowledge there are many changes that occur that are all positive signs of growing up and the body functioning as normal. During the physical and emotional changes that can occur, people can find this to be overwhelming or scary and may spark important questions on why this is happening. So it is important for us to openly communicate about these changes and give reassurance to children that this is a normal and healthy part of growing up.
All right, great. Thanks, Sal. The most common questions that we received from parents were about changes that happen during puberty. And it's great that parents are so interested in supporting their children about this topic because it's such an important one, and it's clear that there isn't enough information out there for parents to feel comfortable approaching the conversation. There's a lot of uncertainty when it comes to knowing what to say, what to look out for when discussing puberty with children and young people. So Sal, I thought it might be helpful for us to start if you could just provide a basic overview of what puberty actually is.
Sure. So puberty is the time when children become adults. During this time, hormones become more active and start to create a lot of changes to how children's bodies look and how they feel. It's also when reproductive organs and the brain will mature. Puberty is a normal part of development and can happen at different times and in different ways for everybody. Some of the physical changes that happen during puberty include breast development, muscle growth, changes to voice, acne, hair growth, grow taller, erections, sore nipples, BO, and genitals will grow, just to name a few. Whilst these changes are happening, hormones are also impacting the way people feel. This can include mood swings, feelings of extreme emotion. During puberty, people may also start to feel attraction to others, and they might feel like they want more independence. What's important here is that children understand healthy and appropriate ways to express themselves. So there is a lot going on during puberty, and it's important that children are prepared and know what to expect and how to comfortably and surely as comfortable as they possibly can feel experience these changes. As I mentioned earlier, puberty happens at different times for everyone, so a child may feel uncomfortable or concerned if they are the first of their peers to experience these changes. This is why it is so important that parents talk to their children about these changes before they are going to happen. By having these conversations before children start to experience significant changes to their bodies and the way they feel, it allows young people to understand that these are the changes which happen to everyone and they are a normal part of growing up. And so there are a lot of newly developed books and online resources available to help facilitate discussions with your children and for parents to read through to feel better informed or prepared in conversations. For tips on how and what to talk about, have a listen to our first 2 recordings as part of this series.
Awesome. Thanks, Sal. I think you made some really great points there, especially about parents reading up on the very basics of puberty, because even though it's something that we've all been through, to actually have conversations and to provide information to young people about this is a completely different thing, and I would think it will be really helpful for parents to just sort of brush up on the basics.
Thanks, Sarah. Definitely. So parents and trusted adults obviously have a key role in providing support to young people during puberty. By definition, parents and adults have been through this themselves, and they're in a great position to prepare kids and to support them. I think it's important for kids and for adults to know that puberty occurs very differently for different people. So it can be a very gradual process, or sometimes it can appear to happen very suddenly or in rapid bursts. And really importantly, it can start at different times for different people. So some young people will be embarrassed or confronted if their development occurs earlier or quicker than those around them. And at the same time, others will feel embarrassed or think something is wrong if they're developing or changing more slowly than those around them. So it's a really tricky time, and support and communication is particularly important. So as people who have been through puberty, we know there are changes that can be seen, and there's also transformations that are not visible but are every bit as significant. So this includes emotional and sexual changes. And this can be a really great and exciting time for young people, but it can also feel pretty scary, overwhelming and confusing. So although you might feel embarrassed or awkward having conversations about these changes with your child or a young person in your life, and they will likely perhaps feel that same way too, the benefit of having these conversations is huge, and it will have an impact on your child long into their adult years and on them understanding themselves. I really do think that the earlier you start, the better. You can start preparing children for changes before they happen, and this will make it easier for them to recognise these changes when they do come and to speak to you about them and about what they're noticing. So, for example, a really easy way to start these conversations is the fact that your child will undoubtedly have noticed that, and quite early, that your body looks quite different to theirs. So talk to them about that, let them know why that is, and start a conversation early about the things that happen to all of our bodies as we grow and get older.
Thank you, Susan. You've made some really good points there regarding why it's important for parents to talk to their children about puberty. I've got a question for you, Sarah, now. So what do we know happens when children and parents have positive conversations about puberty?
Yeah, I mean, there's a lot of great things that can come from ongoing communication between parents and children. It's an opportunity to learn lots about each other, and your child is more likely to feel connected, supported and understood by you. We know that when it comes to sexuality, that the information and the experiences that children have early on are going to have a really significant impact later on in their lives. And we know that during puberty, children are going to have so many questions about their bodies and their gender, relationships and their health in general. And that's why I think it's just so important that parents carefully consider how they respond to their child's sexual development. We know that if parents from an early age are open and non-judgmental and allow their children to honestly share their concerns and questions without feeling embarrassed or ashamed, then children are actually going to view parents as a trusted adult who they genuinely want to share their experiences with. So a level of trust and comfort needs to be established, and the earlier that this happens, then the better.
Thanks, Sarah. So as well as the intentional conversations we have with children, there is a lot that can be conveyed without us meaning to. It's important that parents consider the way that they talk about their own bodies and the messages they send to children.
Yes, absolutely, Sal. Children and young people pick up so much from their surroundings, and that includes messages that parents might not even know that they're putting out there. And I know it can be hard for all of us to be aware or conscious of the messages that we're sending about ideal bodies and beauty standards, especially when we've grown up in a society that's been throwing these in front of us left, right and centre. I mean, it's in magazines and diets and movies and the way that people around us expect our bodies to look. But I think it's really important to try and change that standard and not just conform to what we're used to, and to try not to place those expectations on children and young people now. We know that healthy body image is particularly important for children as they go through puberty. Their bodies are going to be going through so many different changes and will be looking very different. And so we want to let them know that the important thing is to be happy and healthy. And we want young people to believe that this is more important than how their body is looking, because they'll experience so many changes to how they look and understand their bodies to be, but we want them to be comfortable with that as they're navigating so many expectations that are out there in society. We also want them to understand that everybody's bodies will be coming in different shapes and sizes and abilities, and that's okay. So start conversations early that let your child know that everybody looks different, and that there will be bodies that might not look like your child, but they're as healthy and beautiful as each other. We want to encourage children and young people to have positive feelings about their own body, and we want them to respect others and not shame any other bodies. So like I was saying before, children and young people are going to be exposed to social media, TV, movies, friends and family, all of which expect them to look a certain way. And we can't stop that. We can't have any control over that. But what we can do is help children as best as we can have confidence and love for their bodies and the things that they can do. We want to encourage the belief that the standards in society aren't realistic. So alongside the direct conversations that parents are having with children, it's also important that parents consider their own attitudes and beliefs, because children at an early age will be influenced by their parents, and their understanding of what is beautiful will really be influenced by the messages that parents are sending. So as parents, how do you talk about your own body? Do you make negative comments about weight gain when your family is watching TV? Do you comment on a certain type of person for being beautiful? And are those comments about appearance only, or do you share admiration for people based on who they are as a person? So I want parents to consider simple statements that they make. Something as simple as saying no to cake, no thanks, chocolate will make me feel fat. If your child is hearing that and they're eating chocolate, they might think, oh, if I eat chocolate, I'm fat, and that must be a bad thing. And this might seem like nothing, but it really does encourage an unhealthy relationship with food. It's important that parents consider the way that they talk about bodies around their children. Parents can have a lot of great intentions encouraging their child to have a positive relationship with their bodies, but this could be undone, and these efforts could be undone if your child hears you contradict yourself, talking negatively about your own body or those of others. A colleague shared quite a shocking stat the other day that 66% of teenagers whose parents comment on their weight are more likely to be overweight or obese as adults. And we know that commenting on a child's weight can be harmful, even if there are good intentions behind it. So instead of commenting about weight, instead try to focus the conversation on healthy eating and exercise and the benefits that can come from that.
Thank you, Sarah. You've made some interesting points about bodies there. What about when it comes to gender stereotypes? We know that expectations around children's gender can have a really significant impact on children and young people.
Yeah, I'm really glad that you raised this question, Sal, because it's such an important part of children and young people's development that it's so often left out of the conversation, or it's just not considered at all. Rigid gender roles and stereotypes are harmful for all of us. It's not just children and young people. And if we set up expectations and rules for children, there's a real risk that we limit their potential as young people and adults. And I know that many of us might not even realise that we're enforcing stereotypes. It's just the way that things have been. So it could be the toys that you choose your child, or the clothes and hairstyles that you like them to have. Or maybe you might make your child feel like they're doing something wrong if they're not doing the masculine or feminine thing they're expected to. An example of this might be telling a boy that they shouldn't be crying, or they shouldn't be wearing feminine clothes, or maybe telling a girl that they shouldn't be tackling in footy. They might seem like harmless, simple choices that you don't think twice about, but what your child is understanding now and what expectations or things that they feel like they should or shouldn't be doing are actually going to have a significant influence in the way that they manage their emotions and feel like that they can or can't express them. It'll also influence the way that they feel about themselves and others, and it's going to influence the way that they feel they can be in relationships, and it's also going to impact their health as adults. The thing is that we want children and young people to feel that they can honestly express themselves and not be limited by the standards and expectations others are telling them that they need to listen to. So as parents, I would just ask you to consider what you expect from gender roles and why, and how would you respond if your child wanted to behave or look as something that was outside of the box? And would that response that you're giving encourage your child to come to you for support for other things? All right, so moving on to our next topic, we're going to discuss what parents should talk about with their children. I know that this is a big question, so we will just focus on answering the topics that were raised by parents in Melton. So, Susan, I'm just going to shoot over to you for the first topic, which is about how parents can support their child as they experience changes to their body.
Thank you, Sarah. So, as you've already said, obviously this is a time when young people feel very self-conscious and unsure about their bodies. They'll definitely be making comparisons to others, and young people as well, perhaps more so than ever, will be comparing themselves to people that they don't even know, so on social media, television, everywhere. So they're exposed to lots of images of people who look a certain way, and unfortunately those images are often very unrealistic, but they can have a really big impact on young people's confidence around their body and their appearance. As I said before, it's crucial that young people are aware that puberty is experienced differently by everyone, but that it is something that everyone experiences, and it's a really normal part of life. Parents can, as I mentioned earlier, certainly prepare their children for puberty in advance. So talk to children about their bodies, how they work, and how to care for their bodies as they go through different stages of their life. Something really important here around this time in young people's life is that this is a time when they might also start thinking a little bit more about their gender and their identity and their sexuality. So the importance of young people having the opportunity to have safe and judgment-free conversations with trusted adults around these topics cannot be overstated. Without this, the impact of confusion, isolation, and even shame that can occur for young people who have questions about their sex, gender, and sexuality can have a significant impact on their mental health and well-being. And I'm not trying to pretend in saying that these are easy conversations to have. Surely these are not topics that everyone has a great deal of experience with, and we're all learning more about the complexity of gender and sexuality all the time. And I can include myself, Sarah, and Sal as people who work in this field every day. We're evolving all the time in our knowledge and learning new things, and that's completely normal, and there's a lot of support you can get to help you to understand these topics. The other thing that is quite complex and can be a bit overwhelming is changes to language and different terminology that you may not be used to either. So the best thing to know about this is that there are specialist expert organisations and resources and healthcare workers who are there to help adults and young people to learn more about these topics and to support and guide you and your child if you need it.
Yeah, great, Susan. Sexuality is definitely something that we don't expect anyone to fully understand, and it's something that changes all the time. And like you said, our understanding, even though we work within this space and work closely with it every day, is constantly growing and evolving. So yeah, I just want to reiterate that parents shouldn't feel like they are fully across any of this. It's just more important that you're there being a person that your child can explore this with. All right, I'm going to go to you, Sal, for the next question. We had a number of parents ask at what age they should talk to their daughters about periods and what to tell them about it. So if you could just share your thoughts on what a good response for this would be.
Thanks, Sarah. That is a really important question. So firstly, I think it's important that it's not just young girls we are talking to about this. People of all genders with a uterus also experience menstruation. It is also important to educate young boys about periods. By educating boys about periods, it helps remove the existent taboo and stigma that still exists around periods. It's important for young boys to understand why periods happen, that people can become pregnant once they start their period, and for them to know what's happening during a menstrual cycle, for example, pain. This includes making boys aware of menstrual products and encouraging respect for people when discussing periods. No more of the schoolyard, she's on her rags, or it's Shark Week comments. When young people of all genders know how periods work, they develop an understanding without shame. They can learn what to expect without being fearful of the process, and they can better support others who menstruate. In response to when to have this conversation, I would suggest it's an ongoing process rather than one conversation. Periods can start as early as 8 years old, so try using opportunities such as TV ads or using pads and tampons, or just asking your child what they already know. It's important to use correct anatomical terms, even if it feels strange. Use words like vagina As with all the topics in these recordings, there is so much that can be spoken about. These discussions are really helped by using resources such as books and online material. The key things I would share with children about periods would be explaining that this is what the body does to prepare itself for a possible pregnancy, that it will generally happen each month, and that the bleeding generally occurs every cycle, unless you are pregnant, of course. Also, that periods might be irregular sometimes, such as the flow or the heaviness can change at different times. It is good to explain periods as part of a cycle so that young people also become aware of ovulation and fertility, which will help them understand what's going on with their bodies at different times. You can also help young people to understand how to look after themselves during their period, including managing discomfort, seeking help, support if they have pain. Pain should not be ignored or minimized, it should be explored. You can talk about the different options there are now in terms of menstrual products. So we've never had more options than we do now. And so it's important to debunk myths like the idea that periods are gross or embarrassing, or that you can't swim or do the things you love just because you have your period. And obviously it's vitally important for all young people to know that once someone has their period, a pregnancy can occur.
Great. Thanks, Sal. Yeah, I think you've made some really important points there, highlighting that it's not just young girls who should know about periods and what's going on, because there are people of other genders who are going to have periods, and it's also really important that those who don't have periods will understand what's going on for those who do, just to be able to make it a less shameful or taboo topic, and for people to have a good understanding of what's going on. So I'm going to ask you next, Susan. We had a number of parents ask how to approach the conversation of masturbation. I know that this could be quite a tricky topic to start talking to your child about, and I thought you might be able to share some ideas on how parents can engage with this.
Yeah, thank you, Sarah. Certainly the topic of masturbation is a really difficult one for parents, and one that comes up quite a lot. It can be really hard for parents to come to grips with seeing their kids as sexual beings, just as it's a lot of young people don't like associating anything to do with sex and sexuality with their own parents. So it's a taboo topic in our culture, especially I think the concept of female masturbation. And I think that actually says a lot about our discomfort with the idea of female sexuality and their desire and entitlement to pleasure, which is certainly something that I would like to see change in our culture. The fact is that masturbation is a healthy way of people exploring their own bodies and about figuring out what it can do, what feels good, and also learning that your pleasure and the capacity that you have to feel good is not dependent on others, which I think is a really empowering thing for young people to learn. So I think we do need to let young people know that they're not doing anything wrong. Masturbation is a normal thing, nothing to be ashamed of, and it's completely okay. However, there are things that young people might need to learn about what's appropriate for public and private spaces. So I think parents talk to young people all the time about what are considered public and private behaviours. So I think that's an important conversation around masturbation as well. So, it's important to let young people know what they're doing and exploring is nothing wrong, but they might be doing it in a place that isn't appropriate or might make other people feel embarrassed and uncomfortable, and to be aware of that. But do try not, as I said, to make your child feel like they've done something wrong, or that they're in any kind of trouble, or if there's something wrong with them for exploring masturbation. It's a really very normal part of their development. With this and with all of these topics, Sarah, I think it's really important to note as we have that it's absolutely not easy to having these conversations with the young people in your life. As we've said throughout this podcast series, none of us were really brought up, most of us were not really brought up having open, frank conversations about these topics, and it can be awkward and embarrassing. But there are heaps of resources available to parents and to young people about puberty and about sexuality and about all of these topics. So, for example, Family Planning Victoria has brilliant resources. There's a great website called scarletting.com and another one called amaze.org.au. And they provide brilliant resources for young people and for the adults that are looking to support them through all of these changes. Also, Women's Health West ourselves, we've developed a fantastic A to Z poster and resource of topics exploring bodies, health, contraception, periods, and I think this would be another helpful resource to share with your children and to start conversations with.
Awesome. Thank you, Susan. Well, we are nearing the end of this recording, so before we leave, I was hoping to just get each of us to share a parting comment that we have for parents listening. Sal, did you want to start?
Sure. So I think we can acknowledge that puberty is a great time for change for young people and for parents, but parents can play an important role in their child's development by creating that safe space so that children are able to openly express themselves and feel comfortable enough to have these conversations. Puberty happens at different times for everyone, and that they may feel embarrassed or awkward amongst their peers if they are the first to experience this. Parents can help children feel supported by having these conversations early on and to reassure them that everybody develops at their own pace and that this is okay. Lastly, we want to encourage parents to support children by practicing inclusivity in their language and to approach conversations in a non-judgmental manner, as acceptance and identity is one of the many concerns they may experience throughout the journey of puberty.
I would have to say that I think the most important thing a parent can do to support a young person through puberty is to be a really soft landing for them during this really what can be a difficult and strange time. So to be kind and to be compassionate during all of these changes. I think it's really good for parents to know that young people are really and sometimes painfully aware of the ways in which their bodies might be changing and might look different to other people's. They might need your support, but they certainly don't need any judgment from you or scrutiny about their appearance. I personally have a lot of friends who had adults in their lives who made comments to them about their bodily changes during puberty, so making comments about acne or shifts in weight or body hair or BO. And generally those comments, I think, from adults came from a place of wanting to be helpful in some way, but it really doesn't help. It can just increase insecurity and shame about appearance. So please be aware that the young people in your life know how they are appearing to others at this time. They are often very critical or mean to themselves about how they're appearing at this time, and unfortunately other people might be giving them a hard time about changes in their appearance too. So what they really don't need is for you to join that chorus. They need to know that you love them, that you think that they're doing great with all of these changes, and that if any of the changes they're going through are hard or problematic for them or they need support around, even clinical support or seeing a doctor, to let them know that you can help them with that, especially around anything they might find troublesome or painful. But yeah, it's about being kind, soft and understanding, I think, during a really difficult time for many young people.
Great. I love what you said there, Sal and Susan. I think the only thing that I would add is to say that puberty is such a big part of our lives, and we know that parents really can help children prepare and understand this part of their life. And we want to try to normalise conversations about puberty, including the awkward topics like erections and periods. So I would just like parents to see that the changes that happen into bodies during puberty shouldn't really be viewed any differently to, say, children losing their teeth. I mean, both of them occur when children grow into an adults. So imagine not sharing with your child that losing their teeth was a healthy and normal part of growing up. It would be so scary. So we don't want to leave children and young people feeling scared and isolated, especially when they're going through some of the most significant moments of change in their lifetime. Well, that is it from us today. Thank you to everyone who's listening. If you would like more information about supporting your child during puberty, you can check out our website or Instagram page for some resources. And if you want to hear our conversation about how to support your child's safety online, please have a listen to our next and final recording of the series.